All right, so I have been asked to do a video on breath sounds. So first we're going to talk about normal breath sounds, and then we're going to talk a little bit about abnormal breath sounds. So let's go ahead and get into it. Okay, so this is, we're going to call him chest or chest. And so I have markings. I don't have my stethoscope with me, but I have markings of where you're going to hear the three main types of normal breath sounds. Okay, these are normal. So up here at the top where the yellow strips are, these represent the larger airways like the trachea. These are where you're going to hear what we call bronchial breath sounds. So like I said, they're heard over the large airways. They are considered normal when you hear them where you're supposed to hear them. They are very tubular sounding, kind of hollow. They're very loud and unmistakable to hear because they're loud and harsh sounding, but they are considered normal breath sounds when heard over those larger airways. So this is what bronchial breath sounds sound like. So next we have my red dots. These are where you're going to hear broncho-vesicular breath sounds. These again are normal breath sounds. Usually you're going to hear them between the scapula and the center part of the chest where the red dots are. They're going to be heard equally during inspiration and expiration. And this is what broncho-vesicular breath sounds sound like. So you see they're kind of mid-range in their pitch and intensity. They're not as loud, tubular, and hollow sounding as bronchial breath sounds. So finally, we have come to the vesicular breath sounds, which are soft, kind of blowing sounds that you're going to hear throughout most of the lung fields, as you see by my blue stickers here. So out in the periphery and in the lower portions of the lung bases, that's where you're going to hear vesicular breath sounds. These are normal sounds, and this is what they sound like. So that covers our normal breath sounds. So again, bronchial breath sounds are normally heard up here over the larger airways. Those are very loud, tubular, hollow sounds. Bronchovesicular sounds are kind of heard between the scapula and the center part of the chest. They are heard equally on inspiration and expiration. And then we have the vesicular breath sounds that we hear throughout most of the lung fields. And those are all our normal breath sounds. So let's get into the abnormal breath sounds that you're likely to encounter in clinical. So I'm going to start off with wheezing. So wheezing is a sound that's made by air that's moving through a constricted airway. And we most closely associate wheezing with like an asthma attack. So it's like a high-pitched sound. And remember this for your exam, that wheezes are worse if they are heard on expiration. And so an inspiratory wheeze is not as critical as an expiratory wheeze, but this is what an expiratory wheeze is going to sound like. It kind of sounds like you're whistling through a narrow tube. And so that's wheezing. Again, it is an abnormal sound, and it is worse if you're hearing wheezes on expiration. All right, so next we're going to talk about crackles. So crackles are also referred to as rails. Those terms are interchangeable. And so crackles are made when there is fluid that is collected in the small airways. So think fluid in the alveoli, as in like CHF, pneumonia, pulmonary edema. These do not clear with a cough because the sound is made by fluid that is collected in the very small airways all the way down to the alveoli. Okay, they can further be classified as fine, medium, or coarse. I'm not going to get that in depth with it, but this is what crackles sound like. So it almost sounds like a popping sound, kind of a Rice Krispie sound, however you want to describe it. But always remember, crackles do not clear with a cough. They are caused by fluid that is collected in the small airways, the alveoli. So think of disease processes like pulmonary edema, congestive heart failure, instances of fluid volume overload that's going to lead to crackles. And also remember that crackles is interchangeable with the term rails. Okay, so next let's talk about rhonchi. So rhonchi are caused by fluid that is collected in the large airways. And I do a demonstration when I teach about rhonchi. So rhonchi can be cleared with a cough. I can guarantee you almost every single one of you have experienced rhonchi if you have ever developed bronchitis after a cold. And so it's that gunk that's in your throat that does clear with a cough. So it's like a gurgling or a bubbling sound. It's very rough. It's hard to mistake. But this is what rhonchi sounds like in your patient. It kind of reminds me of a patient trying to, clear that stuff out of their throat, but that's rhonchi. Okay, I've saved the worst for last, and this is stridor. Stridor is a high-pitched, you'll hear it described as a crowing sound. It means that there is an obstruction of the upper airway, and this is absolutely a medical emergency. This is the breath sound you never, ever want to hear in your patient. And this is what it sounds like. Very, very scary sound. So that wraps up normal breath sounds, abnormal breath sounds. I hope this kind of gives you a little bit of insight as to what to expect in your health assessment lab talking about breath sounds. And as always, happy studying and go Vols.